May dagdag na paraan laban sa COVID-19. Together, we can be the Solusyon Plus. Bida Plus sa maayos na daloy ng hangin. Bida Plus sa maikling pisikal na interaksyon. Bida Plus sa pagsuporta sa bakuna. Bida Plus sa mga kwento ng kaligtasan sa Bida Barangay. Sa dagdag na pag-iingat, maraming buhay ang maliligtas. Bida Solusyon Plus laban sa COVID-19.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organic.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness Wednesday.
Sisira yung sense of smell natin. Ang sense of smell natin ay nagpapagat ng kumain. Mahirap na at meron pang other factors na may sakit sa puso. Dati nang may sakit sa kidney. Mas mali.
Wellness Wednesdays with Organic. We care because you matter.
Hi, and welcome to Wellness Wednesdays with Organic. Good afternoon. I am once again your host for today's episode. For the past few weeks, it's been Mosh Cruz, who's a really wonderful influencer, and I recommend you guys check her out on Instagram. So thank you, Mosh, for hosting these past few weeks. Once again, I'm back and here to talk today about healthcare. But before we get into that, today's game. So if you go check us out on our Facebook page here at Organic Inc., you can check this post and comment below on who you think this is. So guess who? He's best known for being CNN's chief medical correspondent. He also serves as an associate chief of neurology at the Grady Memorial Hospital in Atlanta and is an associate professor of neurology at Emory University School of Medicine. So all the correct answers, well, not all of them. So the top 5 correct answers, and this is just random, not like if you comment first, then you're gonna win, no? Pero yung top 5 correct answers, you're gonna get a chance to win either an Acai Choco or Acai Coffee trade box. So that's 10 pieces of Acai Coffee or Acai Choco. The choice is yours. And then 1 blister pack of Acai freeze-dried capsules. So hurry and comment so that you can get your chance to win. And there is no walang maximum number of entries. So I think the more you comment, the more noticeable it is, and maybe your comments will just be the next winning comment. Okay, so I think you also noticed that we have a new brand ambassador, si Will Dasovich. I'm sure that, maraming fans natin who are viewers natin are also a fan of Will Dasovich. And then if you've known Will for a while, Will is actually a very big advocate of wellness and health and immunity, kasi Will has been very open about his cancer journey. And it's made him very passionate about a healthy lifestyle, especially yung organic lifestyle. Yung advocacy ni Will is an advocacy that we also share, and that's to put a healthy lifestyle first. Put your health first, because health is wealth, right? And there's no better prevention of diseases than to really put your health first. So speaking of putting your health first, I think the first thing that we need to be able to put our health first is yung proper healthcare system natin. Now, but what is the proper healthcare system? That is the question we're going to be answering today with Dr. Joseph Lee. So Dr. Lee over here is the assistant professor for the section of urology at Fatima University Medical Center. Hi, Doc Lee.
Hello.
Hi, how are you?
Hello, how are you? It's been a while. Good
I know,
afternoon.
it has been. For
Yes,
both
of
you and
course.
me.
Yeah, looking good. And of course, for all our televiewers who are watching us now, this Wellness Wednesday, good afternoon. And those who are abroad, good evening and good morning.
Parang yung line sa line kay Jim Carrey sa Truman Show. If I don't see you, I think it was good afternoon. Good night, or something like that. Yeah.
Exactly.
Yeah,
So
yeah,
I'll
yeah.
see you in
Exactly.
the evening or in the morning or in the afternoon. Which timeline you prefer?
Exactly. So, Doc, I think before we dive into the topic, why is healthcare right now so relevant to most of us? And I think, the big answer there is this pandemic. So what as a doctor who's been part of the healthcare system, what can you say so far about it?
When you talk about, Louisa, the healthcare system,
Mhm.
one is we should have a direct program. When you say direct program, are you talking about standardized program? Are you talking about implementations of advocacy or whatever institution you're talking, private or government perhaps? Okay, are they set up in such a way that this is patient friendly? Sometimes we look at it as the healthcare system on one side. That's why healthcare becomes a failure because it is for the hospital, it is for the owners of the hospital. The government hasn't been looking into what are the needs of the healthcare system, or probably the healthcare system, especially in some far-flung government hospital, needs to be improved in terms of certain aspect that our patient needs to be accommodated on with regards to their health and wellness.
Right. I think also, Doc, no, there's many complications when it comes to yung healthcare system. Kasi there's lots of issues to be considered there.
Mm-hmm.
So before we dive into that, before we dive into the issues, what are the goals of a good healthcare system? What is the ideal, Doc?
Okay, we set up a basically WHO, or the World Health Organization, has certain goals that we follow, and this is spread globally, that we want to attain, not only as a private entity, and also especially for the government who are into the healthcare system. Okay, number one is safety. When we talk about safety, of course, a patient would come in needing help, needing what is that? Cure, needing medicine, needing somebody to care for because there is illness, there is pain, there is suffering, right, Luisa? So initially, safety can go from safety of the infrastructure, meaning the hospital or the healthcare institution, either it's government or private. You don't want your patient going in and suddenly debris comes falling down. So that is adding insult to the pain, right? Okay. So infrastructure, okay. How are the facilities for the patients? Are they complete? Are they equipped for the patient? Okay. Are they safe for the patient? Some equipments or facilities sometimes are too old, or they can be already shelved, rusty. But are we still using it? Are we still utilizing it? Because if these are still being used for our patient, they might not give us the proper health results that are needed in order to improve and take care of our patients, right? One example, Luisa, is our X-ray and diagnostic machines, right? Then, of course, safety with regards to medications. Are we giving them the true value, the true sense of the medications, the drugs? Are we not shortchanging them? We're giving them something that is below par, but we are putting a lot of cost to them. At the end of the day, you bill them and probably they go into cardiac arrest because of the bill. Okay.
Yeah.
So, and safety with regards to how we bring in our medical allies, our doctors, our nurses, the people who works within the healthcare facility or service. They should be safe. Safe in the sense that they take care of our patient. Okay. Number two, this is very important. Effectiveness. Effectiveness in giving service, effectiveness in doing or giving information, educating, effectiveness in delivering the care, the medications, the treatment per se. If you have doctors who are not specialized, who are just there to be, for the heck of earning, there is no empathy, how can there be effectiveness in treatment? There will be not, right? Okay. So everything should go smoothly from paperwork to giving medication to treatment. So it should be
Right.
effective 100%. Luisa, it should not be 60% in one day, then 80%. It is okay 80% in the next day and we'll go on 90%. No, it should be 100% because the patient came into our institution, our health facility, they would require 100% effective treatment and service. Okay, healthcare service. Okay. Number 3.
So Doc,
Okay.
what you're saying is, yung effectiveness, it sounds a lot like safety, no? Kasi you
Yeah.
can't be effective without being safe. So it's a
Exactly.
very integrative part, no?
Exactly. When you look at it, Luisa, they're intertwined. They're web.
Mm-hmm.
They're connected. That's why the WHO wants it in a simplified universal goal wherein these are all implemented in such a way that at the end of the day, this becomes a holistic care which is beneficial to all our patients to give you a very efficient and effective health care. Okay.
Oh, okay.
Okay. Number 3, this is very important. Patient-centered. I think probably you've heard some of your friends. Why are they not empathic? Why do they shout?
Mm.
You know, I'm ill. Why do they shove me? I go to the next hospital. The same thing. And what do the health personnel will say? We're tired. We're busy. We cannot attend to you now. So you
Mm-hmm.
cannot always have, Luisa, you cannot always have that reason of a quote every time you go to each hospital because that is your bare duty and goal. You have to serve with regards to the health care of your patient.
Right.
We sometimes we are losing empathy for some reason of another. There might be factors embedded in it that has been long, been not reconciled because of certain reasons that we need to deal with. Okay.
Mm-hmm.
One is probably the hospital is not giving much of the incentives. Probably the hospital doesn't really care. So if the hospital doesn't really care, so the doctors will not care even, right? Why
Yes.
should
I
we
think,
care? So patient, it's a reciprocal thing. Yes, you were saying.
yeah. Sorry, Doc. Yeah, I can relate to that because I have a few personal experiences regarding yung patient-centered, and that's from both ends. No, like I've had doctors who were very, very patient-centered, and I've had doctors who did not seem to care whatsoever. So
Mhm.
just a few examples, no. So may kilala ko na a relative who had gone to see a doctor, and then the doctor would prescribe medicines pero walang test. Kasi she would yung
I'm
doctor,
laughing. I'm laughing because that's a general complaint. Oh, okay.
yeah,
Walang te.
kasi yung doctor would say, yeah, it's fine. I know I'm the leading expert. So then when we question this doctor, kasi obviously, you're doc, are we sure about this? Kasi it's not getting any better because,
Right.
the medicines aren't targeting the real problem. The doctor will get mad because, why are you questioning me? I'm the expert. So the priority as a doctor wasn't on the patient, but their, I guess, themselves in that sense. And then another personal experience of mine, Doc, is when I was living in Canada. I think this has probably come up in the news, maybe on social media sometimes. Na may systematic racism or sexism sa medical field. So, mga viewers natin, if you're not really familiar, they really my image on the minorities, for example, Asians or Blacks or Latinas or Latinos, that they overreact, or on the women that they overreact and they're not actually as sickly. So I've had an experience, Doc, where I went to yung dalawang male doctors, neither of them or I had a cough for a month. And then what happened, Doc, is when I had to go back to the Philippines, and then they did tests and everything. And then I had permanent lung scarring kasi yung doctor was not doing anything about it.
Right.
Yeah. So ito yung experience. And then I had another doctor who was also a male, but he didn't prescribe me any tests. He just gave me medicine. Unfortunately, the medicine caused a severe allergic reaction where I had to, very, very severe. It was actually a very rare reaction. So I had to change doctors. So yung bagong doctor ko was a Black woman at that time. So she was a Black woman, and she prescribed, I think, like 10 different tests or something. It was so that's just the difference I find sa patient-centered and sa, not so patient-centered kind of healthcare. So yung viewers natin, I know I rambled on about my story there. But if you have any experience, kasi I saw some comments were saying I've also experienced that.
Yeah.
I invite you to join the conversation.
All right. That let me go forth in all your experience. The first one is like the don't care doctor. They will even say, do you know how long I've studied in medicine? Do you know I've studied in the States? Do you know? So you just listen to me and just follow my prescription. Yeah? You have that doctor. They will give you a lengthy lecture of their studies and graduate studies, which you don't care. I don't care. Patients don't care. I don't care how many, where did you study? Where did you extend it? You had your specialization, whatever. They will do that. They will slap it in your face. Yes. And the other one, the last one is, because they do a battery of tests, which sometimes just a simple thing, because of the legal aspect and the lawsuit, they're scared of that. So they request a lot of all the requests, which are, some of them are overlapping. When you say overlapping, you just need this one, you don't need the other one, because at the end of the day, they will have the same results. Unless you have this good insurance that will take care of it, or a HMO that will take care of it, no problem with that. What if not? You're paying, you have a self-employed individual just paying for my health service. You're gonna have a lump sum of a fee of that before the end of the day. And there are some doctors, I think the second one of your example, I just don't care.
Yeah.
I don't care. Just do this. Whatever. So I think the empathy is missing. They lack that on the patient. Sometimes there are doctors, if you experience, Luisa, they don't even look eye to eye to you. They just scribble and scribble in the prescription. You know that? They scribble. Okay, this is it. Yes. Okay, you can come the next scheduled consultation. I'm done. Can I ask question? So how can you ask question, right? Okay, that's the thing. But sometimes you come to think of it, that's why I went to see you, because they say you're the best, you're good. But why I'm not getting what I paid for? So that's a problem. There's
Yes.
a problem of that series. Okay, then the fourth one is timeline. How much, if you program yourself, if you want to implement some new healthcare service which are aligned globally and universally, there should have a timeline. How much time do you give? Are you changing the whole program algorithm? Are you gonna change some of your department, innovation, and all those stuff? How do you do your quality assessment of patient? Do you give feedbacks or you cheat on feedbacks? When I say cheat on feedback, you bring all the feedbacks and you ask your staff to answer it. That's cheating. That's totally
Right.
not allowed.
Right.
So, quality care and good healthcare efficiency should be a balance between your patient, how they see their doctor, how the hospital brings about very good efficiency with regards to achieving the service of health that I need when I go there. Then sufficiently, the amount that I pay is equivalent to the service that I was given to. Then you don't have complaints. That's why we have a battery of complaints because of that. Okay. So you have to have a timeline on how to do, how to. Sometimes people who are in managing hospital don't do that. They just sit there for the heck of the position and to care. 10 years, 20 years, I do not care what happens to this hospital. So sometimes, Luisa, you think of it, why so? This was so fabulous a hospital before. Why now? My mom told me this is the best hospital, but I cannot feel. You get what I mean? I cannot accept why the service is this poor. Okay? You have to do that. Okay?
Actually, Doc, so my question ako ha. So, akala ko yung timeline you were referring to is, from one station to one station. So, for example, operation room to the recovery or whatever. Or if I set an appointment, is it within a good timeline? So, for example, my times kasi when you set an appointment with the doctor, it's not as soon as possible. It's like, oh yeah, next month, huh? You're already, I'm cured from my illness, probably.
Actually, that's part of it. That's part of the change. Okay. So when you talk about it, that's part of the change, because queuing of patients, how
Right.
do they are received from one department to the other section that they don't coalesce or bump into each other, or the movement of service is not delayed. Okay, so I think that is partly the timeline that I was generalizing and saying that, do you want change in what department, change in your people, change in the algorithm, change in the how you make your service more improve and better. And that is one is specific, correct, Luisa? Specific area wherein we need to do it perfectly, because queuing is one thing that if you cannot achieve in a very nice fashionable timeline, it is worse than queuing in a movie house or shopping mall.
Right. So, Doc, my question from Gian Valentona, who says, "Hi, Doc and Luisa Salimbangon. How do you think the Philippine healthcare system can be made better? How much intervention should the government or private institutions play in the healthcare system?" I think this is a very loaded question, Doc. So let's start with part one.
Should
In
I
general,
should I comment? They have been pushing for universal health care. Why is it not being debated? Why is it not being put into table for implementation? Because there's a lot of flows yet. There's a lot of nays and yeah, we do this, we do that. Because that is the problem with our health system with regards to the person, individuals. You know, when they have their different set of ideas, that at the end of the day, they're not compartmentalized. No, one is right, the other one can be true, and the fact is, this is what we in the system that we have is we sometimes go into politicizing it. Yeah, there is political color, so it tends to have a difficult time in moving the Philippine healthcare system. But when you look at it, we have a few people who are doing good and pushing for it. I hope the universal healthcare system, which later on we will talk about, which the Philippines is doing, is can push through in the near future, so that it can be trickled down to the service of our Filipinos who are really in need of it, especially the poor individuals. Okay. The other question is, how much intervention should the government or the private institution play? They should. Government should put in money to healthcare system.
yeah.
Government should look into the bigger picture of the healthcare system. It's just not because, like this pandemic, they just want to do this now and they do not see it in the future. Second, hopefully, if there is money into the whatever plans for the health system, they are properly distributed. You know what I mean, Luisa? They are properly distributed to where they need to be, and not to someone else or what's, you know.
Right.
That's it. Okay. But
Oh yeah, no,
it's
go
a
ahead.
process. It's a process. It's a process that we need to do because actually our healthcare system, you know, for the fact, is also on a very intriguing aspect. You know that some of our leaders in the health sector. So we have to help in our own self, right? In our own capacity.
Yes, I think, Doc, when it comes to improving the healthcare system dito sa Pilipinas, we can always take good examples, good notes from other countries who are very successful in it. I know some European countries are very successful in it. Personally, I come from Canada. I've really had the experience with the free universal healthcare, as in I have almost never had to pay for healthcare there, and I never even had a private insurance. It was
But they do it, Luisa. They do it well.
Yes. So I think, so, for example,
there are no strings attached.
Some notes to take there, Doc, is
right.
There are a few sacrifices. So sa Canada kasi yung taxes are a bit higher than they are here in the Philippines or even in the US. So yung tax money ends up going to fund the healthcare. Pero the advantage there is that people have free healthcare. Another thing is also, that's so internally a government focused thing and also a people thing. Another thing is also externally, yung government natin, I think some people don't realize this. They have to be able to negotiate with other countries to give us access to the advanced technologies and the medicines. Kasi I don't know if you've experienced this, Doc. My pasyente, they go to a hospital here, pero walang treatment dito for their illness, so they have to go abroad.
Exactly.
And that happens many times. And even my personal experience is I wanted to get a vaccine, not for coronavirus, not for COVID. That's a political issue, I think, sometimes. Pero just a vaccine in general. And then they didn't have it because all of the first world countries like the US or Canada or Europe had bought all the stocks for it. So unfortunately, Philippines was not left to any of those kinds of vaccines. So something the government can also do is just negotiate so that we can get better healthcare dito as citizens. What we can do is education when we know what to demand from our institutions and our government. Personal opinion lang ko.
Yeah, that's true. That's true. Sometimes, like when I go to visit some of the hospital, like in Canada, in Australia, and in London, they're perfectly done well. Even the insurance system, I agree with you, Luisa, that you don't need to pay. You just go in, probably present an ID, and that's it. Put your earmark code or whatever. Here, example, our PhilHealth, which is supposed to be beneficial for some reason or another, and for the fact when you listen to the news, it's on intriguing aspect. We don't go into that comment too much because they say that they haven't paid the hospital. So if you don't pay the hospital, how can the hospital give service to the indigent and to the charitable cases, right? So they haven't paid this one. So PhilHealth is an example of an insurance system that if you connect it to a bigger one, the universal health care that they need, should do it. They should do it properly before our healthcare system become better. So I think we have a long way. I agree with you. We look at things in other countries that are good. I envy, like what you say, Canada and the rest of some of the Europeans have with regards to their healthcare system. But we have to be tolerant of what we have because that's it.
I think, Doc, we have to be supportive also. It's still in its infantile stages. Baby pa yung healthcare.
Yes. I agree with you. We have to be supportive. So if you're supportive, then we go to the fifth one, which is efficiency. We're talking about it already. Efficiency in delivering your service, efficiency of information, efficiency of data. This is very important. Data records and all those stuff, because data applications, especially now in the digital, you have forms or even plates that you can forward it abroad. It's paperless. We are already doing it. We're starting to do it. The paperless consultation, the paperless data medical records collecting. That is efficiency. The one that you mentioned a while ago, efficiency when patient moves from one section to the other, they don't have to queue so long, right? And there is a direction wherein they can go. Sometimes when they go to the information, this is the long before, they cannot get the answer they want. Where can I go to this section? You just go there. What? Just go there. Where? And when your hospital
Doon sa kabila, ma'am.
Diba, Luisa, parang sa kabilang building. Anong building? My gosh. Where do you get that? So that is part of efficiency. You put maps. You put maps, directional maps. I'm here right now. So patient can move from one place. And it saves time for them, right?
Right.
Okay. So the
Okay.
other one is
Sustainable goals.
sustainable goal. What is the sustainable goals that we have? We want to improve lives. We want to have our patient experience that they are being taken care of. They are it's like their second home. We like our specialists, our doctors, our nurses to be empathic. You know,
Mhm.
it's not like a hell house. Then when they go there, everybody's like so angry, so moody. So I'm already sick. A patient will say, "I'm already sick." So what? I don't want to see all your faces. Then they will see. There should be smile. There'd be.
Mhm.
I know some would work more than the hours, but we have to instill on that more care to our patients because that is
Right.
our role. Not only the hospital, not only the people that manage the hospital, not only the person that manage directly the hospital, the patient itself. What I mean, the doctors, the nurses, the allied
Mhm.
caretakers, but even way down below, the janitors, the security, they should all have this one alignment goal, which is sustainable, so that you make the life and the comfort of the patient perfect.
Right.
Okay.
Well, Doc, about that actually, I like how we're talking about these goals, and sometimes when we talk about it, sounds very pessimistic, like, paano, like how are we supposed to attain these, no? Pero I just wanted to put a positive note on this also, that I've actually had an experience in a hospital here in the Philippines, actually in Manila. So all of the staff, everyone was very, very patient centered, very, very
Mhm.
dedicated. Yeah, us, we're there, we're like part of the patient side. We're so stressed out of our minds, and then they're
Mm.
very comforting. They're smiling. It
Mm.
really, really makes a big difference, because some of the doctors would show up out of their hours. They would go overtime. Some people had already they already clocked out, and then they heard, oh my gosh, they need us. Yeah, I'll come right back. Sure, no problem. So I think it really makes a big difference, Doc, and it's very possible. So just viewers, note that it's not impossible. These goals, it's possible.
Yeah.
Pero maybe
Yeah.
pa yung healthcare system natin. So my examples, at least, there's hope here in the Philippines for our healthcare
Yeah.
system.
Because we are a loving people. We're loving
Mhm.
country. We
Yes, we
smile
are.
a lot. So that's number one. I think what we need, Louisa, is from the upper administration to trickle down to the people and to set example and tell them that we should have this sort of a behavior within ourselves and within the area of the health facility, so that we can show the patients that we truly are on top of their healthcare system. Okay, so this is like what we say, what we're talking about. This is what we want globally in the next 2,000 years. It has been always been the goal of the WHO to have a benchmark, to have a standardization of this whole global healthcare system, wherein there is efficiency, the characters of the behaviors of the people who are giving the healthcare system are entwined with the patient's care with regards to their illness and health.
Right. So, Doc, what about this slide? So, what is global health service delivery?
Okay, so you have to deliver it. When we say global health service is delivery, is like we follow a standard. We always follow a standard. We have a mother healthcare umbrella that we follow, which is the WHO. Then the WHO has certain principles and protocols that we can follow, that you can have reference from that. They have a full set of what do you call that, services, programs of other countries that they can influence or tell us, or we can follow them. They can give conferences or press con telling that, or this country is good in giving their health service. You can follow them, and most of the time they have their own visiting consultant or representative coming to the country to help the country with regards to their healthcare service system. Okay. Like
Yeah.
now, remember, we have WHO representative coming to our country with regards to the rise of our COVID cases. So that's what they do. That's part and parcel of a very good mother umbrella health institution, wherein they help the not only in specific countries or big countries or developed countries, but even developing countries to improve their healthcare system.
Right. I think, Doc, this goes back to yung sinabi ko kanina was about taking the examples of these other countries, no? And learning from them to improve our healthcare.
Exactly. You hit it right.
So, Doc, these are the goals. What about the challenges in our health?
Yan ang challenges. So, we have that. I will enumerate some of the challenges. Strategic challenge. Okay. Like in the Philippines, we want a universal healthcare system. I cross my fingers that what you said, we should support. Yeah, we will support. The system should be in place. The system is good for the less fortunate. Yes. But what I say is the implementation and the program should be in place. The money that is pumped in from the government should be used properly and appropriately so that this program will achieve its highest 100%. You get what I mean? It's not, you just want to have a universal health system. But patient later on will bombard you with all the complaints. Why is it like this? Why is it like this? You say it's like this. You say I can get this one as free. You were saying, Luisa, your experience was so fantastic. So we have the universal health system here. Why am I still paying this? That is what I'm saying. Strategically, there should be a linear system wherein this is what we do, this is what we do, and this is what we do. Okay? The next challenge is people. So you hire people in the hospital. You have people that manage the hospital. Do you have incentives? Do you give hazard pay? You heard it in the news. We have nurses coming in. They do not like to apply because I think the pay are coming in late. I hope they come in right, because you do not let people, human individuals, work and overwork without incentive. Incentive is like a positive thing. It's a modifying thing. It's a motivation. It pushes you to do your good. It's like our company, Organic. You give awards, you give rewards, you give certificates. And the person who is working for you will say, wow, I did something good. I should do it. I should excel more. So strategically, the people tend to be more favorable in giving you their 100% output. Okay, because some of them they don't. Okay, the care challenges is when you talk about who are surrounding the institution, the hospital, the doctors. Are the doctors doing their duty, or the doctor just comes in, takes the consultation, and that's out? And you have an institution or brand institution that you need to take care of, like a very nice hospital with a brand, and all your doctors are non-empathic. So how will you say that? The feedback is way below. When you talk about manpower, resources, they are way way far below of your integral structure. When you say integral structure, Luisa, you have a very fabulous facade of the hospital. So nice. Lots of paintings. I'm not mentioning it, but your people are worse. So how can you say you will have a good health service, right? Your patients will complain. It should come interconnect. I like the hospital. I like the ambience. I like the people. People are smiling. Even if I don't know them, they just keep on smiling. Okay? So you have to have that care. And we have to put in a lot of empathy because we are losing that. Even our young doctors, sometimes they're not empathic. They just see patient and they go, bah, that's it. No? Okay. So like what we're saying, we need a global health workforce network because we have to interact eventually with other countries. We follow the good, we throw the bad, okay, to the waste bin. Okay, we follow, we do telemedicine, we are doing that. We compare what is being done good in other countries. Can you share it to us? That's why we can share our doctors. We bring our doctors there, and their doctors can come here, specialists, to interact with that. That is what the WHO wants, Global Health Workforce Network. We exchange human resources, okay? Because we should, and you cannot live alone in a country that is developed and you just have this high developed healthcare system without sharing it, right? You agree with that? Okay, all right. Okay, so these are the some of the things that we need to strategize very. So mainly, these are the three things that we need to have, like what we said, for in order to achieve a very good healthcare system. Quality of service, we've talked about it. Safety measures, implementation, standardization, and this is it, universal access to health service. It's like universal health care. Okay? So everybody should have access to it. Okay.
Right. So, Doc, I think yung takeaways ko regarding this, correct me if I'm wrong, huh? Because that's why I'm leaving it here. Yung takeaways ko regarding this is may dalawang aspects sa healthcare. One is people. It has to be very patient-centered, very empathy-centered. So,
yeah.
So the people, the patients, we really have to put their needs first, no, before the needs sa hospital or yung needs or yung wants sa doctor. And then we also have to put the needs of yung staff or the doctors or the healthcare workers kasi yung hazard pay, right? Yung incentives, or if they are so busy, the doctors are always so busy kasi they're understaffed. Right? I think ito yung issue dito sa pandemic kasi, you know, no one really wants to be a doctor or a nurse or anything because there's no pay and there's no rest hours.
You know, Luisa, but if this is the thing, this is a trick. But if the upper management or the hospital institution treats the health individual or their health workers really good, even if you're understaffed, they will work overtime for you without complaining. That the problem is, if you don't treat them, they will complain. Right? That's what like what you're saying.
Right. Kasi nasa puso nila, no, to really take care of their patients. They really have the passion for healthcare. So again, one aspect is yung empathy, very people-centered, and then the other aspect is yung technical abilities and safety, which we learn from other countries when we do our interactions with them, no? Para we can also improve yung access dito sa country. So is that correct? In my takeaways, Doc?
Exactly.
And me summarizing everything.
Yes, that's true, Luisa. You do not undermine and tell yourself that you do not have like what high-tech machines like Canada has. You know, if you have what you have here, but you still give the good service, you will still attain a very high level of healthcare efficiency to your patient. It doesn't matter if your ultrasound is 2D and they're using already 5D ultrasound, but you are taking care of your patient personally, you know, there is a lot of your personal touch, then you will match their 5D, you know, ultrasound as compared to your 2D ultrasound.
Right, right. Okay, well, thank you, Doc. I think it was a very, very packed topic, no? Very relevant sa time ngayon, especially with this pandemic, and then many people are trying to access healthcare. So very good that we have a better understanding of it, no?
Yeah. I think what we do now is like what the pandemic has taught us, like what we need to improve, how we need to implement things, what are lacking in our hospital, especially the government hospital, and these are the things that the Department of Health should proceed in giving their directions to the people who are in charge of it, from the Congress to the Senate, so that they will know, because people above might not know, our legislator will not know. So it is tantamount to say that the people from the Department of Health should be the person on the ground knowing what is needed and telling the people above that this is what we need, this is the budget that we need in order to improve that and improve those steps.
Well, luckily, Doc, DOH is a partner of ours. And then, yeah, just really facilitating this. So thank you, Doc, for spending the afternoon with us and discussing about healthcare.
Yeah, I'll see you.
Yeah, soon. Hope to see you soon, Doc. Take care, huh? Ingat. Okay. All right. So I think that's a very jam-packed topic about healthcare. Ano ba yung takeaways niyo? If whatever your takeaways, don't forget to comment it here below in this video so that we can also see where we can improve and join the discussion. So speaking about healthcare and building our immunity, we have here, this side. Same-day delivery, actually, for all of Organic Acai products dito sa www.organic.com.ph. So sa website natin, please check that out. This is same-day delivery for all areas within NCR and nearby cities. If you're not sure whether your city is available or not, we have our numbers here below. And you can contact them if they are deliver or not. Okay, and then we also invite you to become one of our official Olani direct sellers. You can check them out at Olani PH here on Facebook. So if you really love our products, then we invite you to resell them. So share the health, spread the wealth, right? And then lastly, today's winner. So did you guess it correctly? The correct answer was Dr. Sanjay Gupta. Now, Dr. Sanjay, I've also grown up watching him. So today's winners are, drum roll. Okay, the winners are Connie Hermina, Sarah Lee Andrade, and then Raquel Panganiban, Cybel Draymond, Gonzala Beroya. So congrats to our winners. We're going to shoot you a message here on Facebook as to your address for delivery and whether you prefer acai choco or acai coffee. So thank you everyone for watching today's episode, and we hope to see you again next week.
Wellness Wednesdays with Organic.